Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary medicine. Question number first, severe pathogenesis in paramphistomiasis is caused by options A, mature flukes, options B, immature or migratory fluke, option C, ova, or options D, all. The right answer is options B, that is immature and migratory fluke. Severe pathogenesis in paramphistomiasis is caused by immature or migratory fluke. Paramphistomium, which is known as a stomach fluke, is important pathological conditions of ruminants, mainly caused by there is a migratory paramphistomum fluke. P. Paramphistomum cervi, which is a rumen fluke, Paramphistomum goti, Paramphistomum microbothrium, and Gigantocotyle explanatum. It's mainly characterized by there is a persistent fetid, which is mainly diarrhea, depressions, dehydrations, and anorexia in animal. Planorbit snail are the intermediate host. Adult fluke of the paramphistomum are more or less harmless and resides mainly in a rumen. Therefore, it is also known as rumen fluke. They cause focal loss of that rumen papillae at the point of their attachment, and maximum and severe pathogenesis is caused by that immature flukes, particularly in that duodenums and upper ileum, and they cause a severe hemorrhage from that point of attachment. And to diagnose that paramphistomum, sedimentations and decanting techniques is used, which is mainly based on that identification of immature flukes, which is seen in feces. If we see in case of gigantocotyle explanatums, which mainly affects that bile duct, gallbladder, and sometimes duodenum, cause superficial hemorrhagic spots indicating there's point of attachment, and in heavy infections we can see there's a paleness of liver, even fibrosis is seen. Okay, questions number second, ivermectin is highly effective in treatment of options A, ascariasis in pig, options B, staphylophilariasis in buffalo, option C, external and internal parasite, or options D, all. The right answer is options D, that is all. Ivermectin is highly effective in the treatment of all, that is ascariasis in pig, Staphylophilariasis in buffalo, and external internal parasites. Ivermectin, which is used as a dewormer, is used to treat multiple species of internal and external parasites. If we see that's internal parasites, which mainly includes gastrointestinal worm like roundworms in horse, cattle, pig, sheep, and goat, as well as lungs worm that is mainly in cattle and pig. And also it is used to treat external parasites, which includes lice, mites, extra. In human, it is used to treat onchocerciasis and lymphatic filariasis. Okay, ivermectin, if you see that ivermectin is a semi-synthetic drugs which is obtained from that microbes Streps evermitilis. Okay, and if we see that's mechanism of actions, then ivermectin either bind to that ivermectin binding site receptor, which is a glutamate gated chloride channel, and also it potentiates GABA-energic transmissions, which leads to that hyperpolarizations conditions, due to which that influx of large amount of chlorine, and they cause that tonic paralysis of worm. Okay, in case of flukes and tapeworm, where that glutamate gated chloride channel is absent, so it is not effective in them. More, it is best for that roundworm. Okay, questions number 3. Pipe stem feces is caused by options A, Babesia bigemina, options B, Babesia cabelli, option C, Babesia divergent, or options D, Babesia bovis. The right answer is options C, that is Babesia divergent. Actually, pipe stem feces is mainly caused due to that the spams which occurs on that anal sphincter. It's seen in both, that's a Babesia divergent and Babesia bovis. But if both have presence in options, we prefer that Babesia divergent. Okay. Babesiosis is also known as tick fever, pyroplasmosis, splenic fever, biliary fever is a tick, mainly that Rhipicephalus, Haemophilus, Derma center, and Ichodis of cattle and buffalo. That is in case of cattle and buffalo, that's mainly Babesia, that's Babesia bigemina, Babesia bovis, Babesia divergent, and Babesia major. In case of horse, we see that's Babesia equi, Babesia cavalli. In case of sheep, we found that Babesia motasi, Babesia obis. In pig, we found that Babesia trotmani. Dog, there's a Babesia canis, Babesia gibsoni. In case of cat, that Babesia felis, mainly characterized by there is a fever and anemia, and there is a hemoglobinemia. There's a deficiency of hemoglobin in blood, and hemoglobinuria. That's we found that hemoglobin in that urine, and there's a pipe stem feces. Okay. Questions number 4. The immature stage of falling liver fluke is continuously migrate in the liver parenchyma so severely without causing encapsulation in such a way that only one or two fluke can kill a sheep. Options A, that's Fasciola gigantica. Options B, Fasciola hepatica. Option C, Dicrocilium dendriticum. Options D, Fascioloids magna. The right answer is options D, that is Fascioloids magna. The immature stage of fascioloids magna liver flukes is continuously migrate in a liver parenchyma so severe without causing encapsulation in such a way that only one or two fluke can kill a sheep. Okay. Fascioloids magna, which is also known as a giant liver fluke, is distinguished from that other fasciola species by its large size and there's a lack of anterior projective cone. It's mainly found in domestic and wild ruminant. In cattle, that's fluke mature, that's the intense, and there's an intense encapsulations response of that cattle's form of that closed cyst, so that a egg rarely pass out of that animal. And if you see that pathogenicity and severity in cattle is low, while in case of sheep and goat, that encapsulation do not occurs, and the parasites migrates in the liver and other organ, causing tremendous damage. Even only one fluke can kill a sheep. Okay. Note that Fasciola gigantica is found in tropical regions, while Fasciola hepatica mainly found in hilly region. And if we see that's Dicrocilium dendricum, which is known as Lancet's liver fluke of ruminants, its first intermediate host is snail, from where that Sarcaria emerges and are aggregated in a mass of sticky mucus, which is known as the slime balls. And these slime balls are ingested by the second intermediate host, uh, and where that metasarcaria form in ants' abdominal cavities. And when this parasites with the intermediate host ingested by the definite host that insisted in that small intestine migrate to the bile duct and cause infections. Okay. Questions number 5. Thumb is the characteristic clinical sign noticed in ascariasis infestations of options A, piglet, options B, foal, option C, calf, options D, pup. The right answer is options A, that is piglet. Thumb is the characteristic clinical sign which is seen in ascariasis in pig. Okay, a large round bump of pig, that is a ascaris thumb, mainly found in the small intestine of pig. They produce large amount number of egg, and this if we see that's earthworm and dung beetle serve as a paratenic host for ascaris thumb. Okay, ascariasis cause that decreased growth rate in young one, cause mechanical obstructions of that intestine, migration through liver, cause hemorrhages, fibrosis, and accumulation of lymphocytes seen as a white milk spot in liver. In heavy infections, that's larva also migrates to the lungs, cause pulmonary edema and consolidations of lungs. Heavy infected pigs, so that's excessive abdominal breathing, which is known as thumbs. Okay. Questions number of 6. Following condition is sequels of canine spirocerciosis. Options A, pulmonary emphysema. Options B, pulmonary osteoarthropathy. Option C, pneumonia. Options D, osteoporosis. The right answer is options B, that is pulmonary osteoarthropathy. Sequels of canine spirocercosis, that is canine spirocercosis, can lead to pulmonary osteoarthropathy. Okay, Spirocerca lupi infestations, which is known as canine spirocercosis, it is actually a bright red worm, generally located within that nodules in that the esophagus, gastrix, or otic wall of a dog. The dog get infected by this Spirocerca lupi by eating an intermediate host, which is usually dung beetle, or transport host, that is a chicken, reptiles, or rodents. The larger larva, that the larva migrates via that wall of celiac artery to that thoracic aorta, characterized by there is a aneurysms of thoracic aorta. Aneurysms means dilation of thoracic aorta, and we also see that reactive granulomas in esophagus, and sometimes often develop hypertrophic osteopathy too. Okay. Questions number 7. Adult Haemonchus contortus worm inhabits options A, rumen, options B, small intestine, option C, abomasum, options D, large intestine. The right answer is option C, that is abomasum. Adult Haemonchus contortus worm mainly found in abomasum of adult animal. Okay, Haemonchus contortus, which is also known as a barber pole worm or wire worm or stomach worm, is most pathogenic that blood sucking nematodes of sheep, goat, cattle, mainly found in abomasum of this animal, characterized by there's a severe anemia and there's anasarca. Anasarca means like a generalized edema of the body. And if we see that's infective stage of Haemonchus contatus, the stage of Haemonchus which affect that definitive host, that is the L3 larva stage. Okay. Questions number 8. Thin sore syndrome is seen in pig affected with options A. Ascarisons, options B. Toxoplasma gondii, option C. Metastrongylos acti, options D. Oesophagostomy dentatum. The right answer is options D, that is Oesophagostomy dentatum, okay, which is known as nodular worm 2. Thin sore syndromes in pig occurs over a period of time with gradual, there's a declining of body conditions until 10 to 30% of animal have a body condition scores between 1 to 2, arises due to that inadequate nutrition or poor quality feeds failing to satisfy the bodily need of the sow, or that the large amount of parasitic infestations, mainly that Oesophagostomy dentatum. Questions number 9. Ear sore in buffalo is caused by options A. Staphylococcus stilesi, options B. Staphylococcus zahiri, option C. Staphylococcus assamensis, options D. Staphylococcus bunkeri. The right answer is options B, that is Staphylococcus zahiri. Ear sore in buffalo is mainly caused by Staphylococcus zahiri. Okay, Filaria stilacis infestations, that is known as Filaria dermatitis of cattle, is a small filarial parasites that cause circumscribed, that is a round dermatitis along with the ventral midline of the cattle between the briskets regions and that's navel regions. And if we see that's intermediate host of that Filaria stilacis is that horn fly, which is Hematobia irritate. Okay, while Staphylococcus assamensis is the cause of common chronic ulcerated growth, which is occur at the base of that dew claw in cattle. Okay, while Staphylococcus bunkeri that causes skin lesions in pig. Questions number 10. The species of Theileria recorded in goat. Options A. Theileria annulata. Options B. Theileria parva. Option C. Theileria hirki. Options D. Theileria mutant. The right answer is option C, that is Theileria hirki. The species of Theileria which is recorded in goat, that is a Theileria hirki, while Theileria annulata, Theileria parva, Theileria mutant are recorded in cattle. Okay. Questions number 11. Blackhead disease of poultry is caused by options A. Heterachis gallinarum. Options B. Histomonas meleagridis. Option C. Eimeria acervulina. Options D. Lipurus caponis. The right answer is options B, that is Histomonas meleagridis. Blackhead disease of a poultry is mainly caused by Histomonas meleagridis, while Histomonas meleagridis is actually anaerobic protozoans, is the causative agents of histomoniasis, that is blackhead disease, mainly transmitted in the egg of sickle nematodes, that is a Heterachis gallinarums, and that earthworms act as a paratenic host for Heterachis gallinarums, that containing large number of Histomonas meleagridis, characterized by there's a listlessness, reduced appetite, drooping wings, unkept feathers, yellow fecal drooping in later stage of disease. Okay. Note there is a Lipurus caponis, which is a wing louse. Okay, is gray, slow moving lice, which is found close to the skin. Questions number 12. Dowring is characterized by options A. Lymph node enlargement, options B. Conjunctivitis, option C. Hemoglobinuria, or options D. Dollar spots. The right answer is options D, that's a dollar spots. Dowring is mainly characterized with the dollar spots. Dowring, which is also known as a covering sickness, because it is a serious and fatal infestation of a protozoans, that is a Trypanosoma equipardum, mainly affect Equidae family, that is a horse, a donkey, and mules, characterized by there's a slow and a progressive disease marked by a period of apparent recovery and followed by against relapse, usually ending in death, and there's a presence of a dollar spots. Okay. Questions number 13. Raksha Vecti is vaccine for options A. Babesia, options B. Theileria, option C. Toxoplasma, options D. Trypanosoma. The right answer is options B, that is Theileria. Raksha Vecti is a vaccine for Theileria. Okay. Questions number 14. Thrombocytopenia is the persistent character of options A. Babesiosis, options B. Ehrlichiosis, option C. Leptospirosis, options D. Theileriosis. The right answer is options B, that is a ehrlichiosis. Thrombocytopenia, which is a low thrombocytes count, is a persistent character of ehrlichiosis. Okay, ehrlichiosis, also known as a canine rickettsiosis or Nairobi bleeding disease, is a disease of actually domestic animals characterized by there is a high rise in temperature, generalized enlargement of lymph node, depression, loss of the body conditions, anemia, thrombocytopenia, mainly caused by rickettsia, that is a ehrlichia, and transmitted through that's bite of tick of genus Emblyoma, Rhipicephalus or Hyaloma. Okay. Questions number 15. Previously healthy puppy began vomiting when first fed on solid diet, and there's no fever and immediately return to that liquid diet, then vomition is stops. Congenital anomalies of cardiovascular systems responsible for this is options A, persistence of right aortic arc, options B, dextrorotation of aorta, option C, subaortic septal defect, or options D, pattern foramen ovale. The right answer is option A, that is a persistent of right aortic arc. Okay. Previously healthy puppy which begins vomiting when first fed on a solid diet, and we found there's a no fever, and immediately when we return to the liquid diet there's a vomition stops. Okay. And then congenital anomalies of cardiovascular systems, which is responsible for this, there's a persistence of right aortic arc. Persistence right aortic arc is a most common vascular ring anomalies which is seen in dog, especially German shepherds, and also reported in cattle, horse, cat, where right aortic arc failed to regress normally, resulting in there's a entrapment of that esophagus and trachea at the level of heart base. The most common clinical sign associated with this persistence of right aortic arch is that regurgitations of food. Okay. If you see there's dextrorotation of aorta, that occurs when that aorta override the interventricular septum to the right ventricular side. Okay. Questions number 16. Vegetative endocarditis may be one of the chief lesions found in options A, bovine traumatic gastritis, options B, swine erysipelas, option C, equine viral arteritis, or options D, hog cholera. The right answer is options B, that is swine erysipelas. Vegetative endocarditis is one of the chief lesions found in swine erysipelas. Swine erysipelas, also known as a diamond skin disease, is an infectious disease of pig, mainly characterized by there's the appearance of a diamond shaped skin lesions in acute form, and there's a suppuratives and vegetative endocarditis in chronic form, mainly caused by erysipelotrix ruseopathics, which is a gram positive bacillus. Okay. Equine viral arteritis is an economically important contagious viral disease of equine caused by equine arteritis virus, characterized by there is a skin lesions, and there is a lacrimations and periorbital edema, scrotal edema, depressions, limbs edema, and nasal discharge extra. Okay, hog cholera, also known as the swine fever, is an acute, highly contagious viral disease of a pig, mainly characterized by there's a rapid and sudden onsets, and we found that's high morbidity and mortality, and there's a generalized hemorrhage, mainly caused by that's hog cholera is mainly caused by pestis of family Flaviviridae, and lesions that associated with hog cholera, that is a we see that's infracted kidney spleen, and the turkey egg shape appearance of a kidney, and button ulcers in cecum and column. Okay. Questions number 17. In intussusceptions in bovine, one of the most characteristic combination of symptoms is options A, partial anorexia and thirst, options B, depressed attitude followed by hyperesthesia, option C, there's a fever 104 to 106 degree Fahrenheit but normal pulse, options D, a tar like bloody, there's an anal discharge together with that's complete suppressions of bowel evacuations. The right answer is options D. That is a tar-like bloody anal discharge together with complete suppressions of bowel evacuations. Okay. In intussusceptions, the in an intussusceptions, there's a one important symptoms is like the tar-colored like blood anal is discharged from that anus, and there's a complete suppression of that evacuations of food. Okay. If we see that intussusception is actually a life-threatening illness occur when that a portion of that intestinal fold like a beings like a telescopes with one segment of intestine that slipping inside into the another segments, and that lead to cause there's obstructions and which preventing the passage of a food that being digested through intestine. Okay. Questions number 18. Antibiotic of choice for use in mastitis caused by Pseudomonas aeruginosa is options A, penicillin, options B, gentamicin, option C, tetracycline, options D, tylosin. The right answer is options B, that is gentamicin. Antibiotic of choice for use in a mastitis caused by Pseudomonas aeruginosa is gentamicin. Antibiotic of choice for mycoplasma, that is a tylosin. Antibiotic of choice for gram-positive bacteria, that is penicillin. Okay. Questions number 19. A deficiency of greater than 10% of a body water is associated with options A, depression, options B, sunken eye, option C, recumbency and moribund state, options D, all. The right answer is options D, all. Okay. A deficiency of greater than 10% of a body water is associated with depression, sunken eye, and recumbency, and there's a moribund states. Let's see some clinical signs and associated with dehydrations. Okay. In case of mild dehydration, 3 to 5% of body loss occurs. In case of moderate dehydration, 6 to 9% of body loss occurs. In case of severe dehydrations, body loss is weight loss is greater than 10%. If we see that's behavior which is normal in mild dehydrations, normal to listless in moderate dehydrations, normal to lethargic or comatose in severe dehydrations. If we see that thrust, that is a slight in mild dehydrations, moderate in case of moderate dehydrations, and intense in case of severe dehydration. If we see that's mucous membrane, which is normal in mild dehydrations, dry in case of moderate and severe dehydrations. If we see that's eye, which is normal in mild dehydrations, and in case of moderate and severe dehydrations, that eye is sunken. Okay, in case of skin turgor, which is normal in mild dehydrations, and there's a decrease in case of both moderate and severe dehydrations. If we see that's blood pressure, which is normal and severe dehydration, that's a decrease. Heart rate, there's a normal and increase in case of moderate and severe dehydrations. And if we see that's urine output, which is decrease in mild dehydrations, markedly decrease in moderate dehydrations, and there's a anuria, which is that's no urine productions in case of severe dehydrations. Okay. Questions number 20. Thickened puffy skin, that is a Mike's edema, is most consistent with options A, hypotrichosis, options B, vitamin E and selenium responsive dermatosis, option C, hypothyroidism, options D, contagion ecthyma. The right answer is option C, that is a hypothyroidism. Thickened puffy skin, that is Mike's edema, is most consistent with hypothyroidism. Okay. Let's see some clinical sign which is associated with hypothyroidism conditions, like there's a fatigues, animal get fatigues, increased sensitivity to colds because of decreased metabolisms, and constipations, which is also due to decreased metabolisms. We found that puffy skin and there's a weight gain because of decreased metabolisms, muscles weakness, and there's a harshness we can see. Okay. Clinical sign which is associated with hypotrichosis. Hypo means decrease, tri means hair. Okay. As alopecia, which is a loss of hair in whole body. Thin eyebrow we can see. Thin eyelashes we can see. There's a sparse body hair, and the thin scalp hair we can see. Okay. Questions number 21st. Primary photosensitization is not related with options A, liver disease, options B, LCK clover, options C, buckwheat, options D, St. John's wort. The right answer is options A, that's liver disease. Okay. Uh, Photosensitizations is that increase susceptibility of skin to damage, mainly caused by like ultraviolet light. It occurs especially in those area where there's a lacking of significant protective hairs. Wool or pigmentations affects all species, but most commonly seen in case of like cattle, sheep, goats, and horse. Okay. If we see that so photosensitization, we found two types of photosensitization reactions: primary photosensitizations and secondary photosensitizations. Okay. Primary photosensitization occurs when the photodynamics agents is either that ingested or injected or absorbed through skin, and these agents enter the systemic circulations in its native forms, reaches the skin, and when it comes to exposure with UV lights, they get active and cause skin damage. Example of some primary photosensitization agents, that is a hyperacin, that is St. John wort, or phagopyrin, which is a buckwheat. Okay. And secondary photosensitization is mainly observed in livestock, in which that photosensitizing agents like phytoerythrin accumulates in plasma because of like impaired hepatobiliary excretions. This phytoerythrin is derived from that the breakdown of that chlorophyll, mainly caused by microorganisms which is found in GI tract. And this phytoerythrins, but not chlorophyll, is normally absorbed into the circulations and effectively excreted by liver into the bile. Okay. And then failure of this excretions, phyloerythrins, due to hepatic dysfunctions, increase its amounts in blood, and thus when it's reached in skin, and it's absorb UV lights and initiating phototoxic reaction. Okay. Questions number 22. Ruminitis liver abscess complex is a common manifestation seen in options A, TRP, which is traumatic reticuloperitonitis. Options B, ammonia toxicity in dairy animal. Option C, lactic acidosis in dairy animal. Options D, abomasal infections. The right answer is option C, that is lactic acidosis in dairy animal. Ruminitis, that's inflammations of rumen, and liver abscess complex is a common manifestation which is mainly seen in lactic acidosis in dairy animal. Let's see some clinical sign which is associated with TRP. Then we found there's a localized peritonitis and arched back condition because of a pain. Ileocytis pain, that's grunting and bruisings. Fibrin depositions and fluid accumulations in peritoneal space. We also found there's a reticular abscess and there's a presence of penetrating foreign bodies. Okay. If we see that's clinical signs which is associated with urea and non-proteinous nitrogen's toxicity, the period from that urea ingestions to that onsets of that clinical sign is generally 20 to 60 minutes in cattle, mainly characterized by there's early sign like nervous signs is more common. There's muscle tremors, especially face and ear muscles. There's abdominal pain and frothy salivations, polyuria and bruxisms. Tremor progress to incoordinations and weakness, pulmonary edema that's lead to marked salivations, dyspnea, and gasping. Let's see some clinical signs which are associated with the lactic acidosis in dairy cattle. That's a decreased feed intake, decreased milk productions, poor body conditions scores, ruminitis, liver abscess, extra. Clinical signs which are associated with abomasal infections. There's a complete anorexia and very scanty feces is coming out from that anus. We found that distension of that abdomen and weight loss and weakness. Okay. Questions number 23. In which displacement cause of death is toxemia and dehydration? Option C, left displacement of abomasum. Options B, right displacement of abomasum. Option C, anterior displacement of abomasum. Options D, all. The right answer is options B, that is the right displacement of abomasum. In right displacement of abomasum, cause of death is actually toxemia and dehydrations. Abomasums mainly lie in the floor of that abdomen, and it is displaced when filled with the gas and go rise to the top of the abdomen. More likely to display to the left side than the right sides. Major cause of that abomasal displacement is that during the pregnancy times that abomasum is get a little bit displaced because of that the enlarged uterus, and after the parturitions abomasum supposed to come to their normal positions, but when the abomasums fail to return to the normal positions after parturitions, and floppiness nature of abomasums, this leads to cause abomasal displacement. Okay. Questions number 24. Burn is often confused with options A, VPI, options B, burn injury, option C, trypanomatosis, options D, coccidiosis. The right answer is option C, that is trypanomatosis. Okay. Burn is an inflammation of that skin of that rabbit. Okay, these all conditions are seen in rabbit, especially on that hind feet and the adjacent parts associated with unclean urine soil cage. Okay, trypanomatosis is also that specific venereal which is sexually transmitted disease of domestic rabbit, mainly caused by that spirochetes Treponema paraluis cuniculi. It's mainly transmitted by breeding and from doe to that offspring, characterized by there's a formation of a small vesicles or ulcers mainly around the genital regions. Okay, VPI or dacryocystitis, which is the inflammations of lacrimal gland, is also seen in rabbit and occurs in one or both eye and often associated with other medical conditions such as conjunctivitis. Also, we can see coccidiosis in rabbits. We found that two forms of coccidiosis in case of rabbit. That's a hepatic forms and another is intestinal form. Hepatic forms coccidiosis is mainly caused by Eimeria stridis, while intestinal coccidiosis is mainly caused by Eimeria magna, Eimeria media, Eimeria perforans, Eimeria intestinalis, extra. Okay. Questions number 25. Murine respiratory mycoplasmosis is characterized by inflammation of respiratory tracts and options A, conjunctiva, options B, nose, option C, that's the external ear, options D, middle ear. The right answer is options D, that is a middle ear. Okay. Murine respiratory mycoplasmosis is a disease of also rabidi. Rat and mice act as a natural host, while hamster, guinea pig, and rabbit, which is act as a another host, caused by Mycoplasma pulmonis. transmitted both by horizontally as well as vertically. Characterized by there's a suppurative rhinitis we can see, and otitis media, inflammations of middle ear, laryngitis, inflammation of larynx, and there is a tracheitis, inflammation of trachea. Okay. Questions number 26. Probang is used to diagnose which? Options A, pharyngeal paralysis. Options B, pharyngeal obstructions. Option C, pharyngitis. Options D, parotitis. The right answer is options B, that is pharyngeal obstructions. Probang is used to diagnose that pharyngeal obstructions. Probanks is actually a surgical tool about 30 to 40 centimeter long, and consisting of there's a flexible rod and at the with a sponge at the end, which is used to remove that foreign bodies or obstructions which occurs in that pharyngeal regions and also physical regions. Okay. Questions number 27. Diabetes mellitus is commonly found in which animal? Options A, dog. Options B, cow. Option C, horse. Options D, goat. The right answer is options A, which is a dog. Okay, diabetes mellitus is a chronic disorder where there's a of carbohydrate metabolisms. Common endocrine disease of dog, mainly that middle-aged dog, and cat, that is middle-aged to that older cat. Mainly characterized by there's a hypoglycemia, which is low glucose level in that blood, with resultant glycosuria, that is a urine comes that glucose comes out in urine due to that relatives or that absolute insulin deficiency, because mainly since due to destructions of islet cells, which is responsible for produce insulin, secondary to either immune destructions or severe pancreatitis, which is seen in dog, or amyloidosis, that is cat. Insulin resistance and secondary diabetes mellitus are seen in many dogs with spontaneous, where there is a hyperadrenocorticism, chronic administrations of glucocorticoids, and since pregnancy and distress conditions predisposed to this diabetes mellitus conditions. Okay. Questions number 28. Enterolith, that is a stones which is found in intestines, are more common found in which animal? Options A, cattle. Options B, dog. Options C, sheep. Options D, horse. The right answer is enterolith is most common found in horse. Okay. Enterolith are most commonly found in horse, typically formed within a diverticulums, as enteroliths forms in a murex diverticulums, sometimes called as Meckel's enteroliths. Okay. Meckel's diverticulum is the remnants of that vitellointestinal duct. Through this duct, nutrients passes from that yolk sac into that midgut of 4-week-old embryo. Questions number 29. Trimethoprim's sulfonamide combinations are available usually in a ratio of options A 1:1, options B 1:3, options C 1:5, options D 1:7. The right answer is option C, that is 1:5. Okay. Trimethoprims and sulfonamide combinations are available usually in a ratio of 1:5. Trimethoprim is sulfonamide, potentiated sulfonamides. Okay. Questions number 30. Majority of the clinical cases of parchment paralysis occurs. Options A, during advanced stage of pregnancy. Options B, during first 48 hours of a parturition. Option C, between 10 to 25 days after parturition. Options D, 1 month after parturition. The right answer is options B, that is during first 48 hours of parturition. Parturient paralysis, which is also known as milk fever, is in cattle, mainly characterized by there is a hypocalcemia, there is a low calcium levels in blood, occurs within 72 hours of a parturition. Okay. That's much for today.